So welcome to Leadership Buffalo's Town Hall. Today's topic is diversity, equity, and inclusion in healthcare in the African American community. We have two fabulous women with us today. Let me give you their very extensive bios. I'm going to try to tell you as much as you realize who we have with us. We have with, oops, hold on one second. I have to get the bio. We have with us Ekua Mends-Aidoo, who has over 12 years of experience working with municipal government, nonprofit, and healthcare organizations. She has been responsible for implementing equitable policies, communications, and programs that align with organizational strategic goals and vision, especially in diverse and underserved populations. She has been instrumental in shaping workplace cultures with the emphasis on maintaining employee engagement through strategic analytics and program design. Ekua has extensive management experience with a focus on creating effective teams. Building relationships with employees and advocating for equitable support and change is a major highlight of her work. She enjoys decision-making with influence from data and the employee experience. Last year, she started Clementine Gold Group, a consulting firm specializing in diversity, equity, and inclusion implementation. This past March, Ekua was recognized with Buffalo's Business First inaugural IDEA Award, which is Inclusion, Diversity, Equity, and Awareness, highlighting her work in the D&I space. I was a judge for that, by the way. Congratulations.
Good to know.
Ekua volunteers with the Emerging Philanthropist of Color, and in 2018, she was appointed by Buffalo Mayor Brown to a 3-year term on the Commission on Citizen Rights and Community Relations, leading the Community Relations Committee. She also serves on the Teach for America Buffalo Leadership Council. She's a 2014 graduate of Leadership Buffalo Rising Leaders, and she's also a member of the Buffalo Urban League's Young Professional and the NAACP Buffalo branch. She has her bachelor's in exercise science and health and wellness from the University of Buffalo, and she has a master's degree in public administration from Hilbert. She also has a certificate in health services administration from Duville, and she's pursuing a certificate in diversity and inclusion at Cornell's ILR school, graduating this fall. Originally from Syracuse, New York, she moved to Buffalo in 2004 to both practice self-care and increase her understanding and respect for different cultures and life perspectives. Ekua enjoys international travel. She's always looking for awesome flight deals, which I'm sure you can find right now. Unfortunately. And then we have with us Kendra Brim. Kendra Brim is a native of Buffalo, New York, and she attended Darden Academy in 2007 before receiving a 4-year division scholarship to Colgate University, where she majored in political science and minored in African American studies. She received her MBA from UB in 2019. And amidst Buffalo's renaissance, Kendra enthusiastically moved back to the area after college, fueled to make a difference in the community. Eager to help advance opportunities for underprivileged minorities, an area that she felt was being left behind, Kendra purposefully became involved with the Buffalo Urban League Young Professionals, the National Black MBA Association, and the William Emsley YMCA, a high-need branch in the city of Buffalo. Kendra ended her tenure as project manager at Blue Cross and Blue Shield of Western New York and enthusiastically returned to her high school alma mater just recently as the first director of diversity, inclusion, and opportunity at Darden Academy. She is the CEO and owner of K Savannah Consulting, a firm that focuses on diversity and inclusion strategies. She served 2 years as chapter president of the Buffalo Urban League Young Professionals, and she's currently the national programs chair for the National Urban League Young Professionals. Kendra also serves as a board member for the Buffalo Urban League, the William Emsley YMCA, Teach for America's Executive Leadership Council, and United Way of Erie County board member. Kendra's motto: service is the rent we pay for the privilege of living on this earth. Some of Kendra's honors, and these are some of Kendra's honors and awards, include the Black Achievers Award, NAACP Buffalo Branch, Daniel R. Acker Community Service Award, Buffalo Business First 30 Under 30, Buffalo Niagara 360 Professional, Commitment to Service for Mayor Brown, and the Darden Academy Sports Hall of Fame. In addition, she is a National Urban League Washington Bureau Advocacy Program and Certificate Fellow. In her spare time, I'm not sure where she has spare time. She enjoys watching movies, spending time with family, and traveling. She also is a Leadership Buffalo grad from the Rising Leaders Program in 2013. Welcome, ladies. In addition to these, all wonderful accolades I just talked about with these wonderful women. They found in their spare time, which I'm not sure how they have any. They started a podcast, which is why you see them in a studio versus sitting behind a Zoom screen in a kitchen like the rest of us are. And it's called Black Gems Dive In. So this is actually going to be streaming to Facebook Live while we are on this Zoom call. So we're very excited about that. And I'm going to turn it over to these ladies. As usual, if you have any questions, we have you on mute, but please make sure that you put the questions in the chat room and we'll try to get to as many as we can. Ekua, Kendra, thanks for being with us, and I'm going to turn it over to you.
Thanks for having us. So like Althea said, we are in a studio. We are the Black Gems Dive In podcast, which is produced by Cruise Control Media. And we decided to start this podcast earlier this summer. Actually, Jamil, who is owner of Cruise Control Media, came to us and said, how about you ladies start a podcast? Yeah. And we said, what? Like, we know nothing about a podcast, but you know, he believed in us and he felt as if we had something to say. Mm-hmm. You know, we get into these smaller pods and we have a great conversation. And people are always asking us about, you know, different ideas. How do we feel about our current climate in the world today? And so we said, why not do a podcast? Yeah. So here we are today. I mean, it was a lot more than that, but that's the shorter version.
That's the shorter version. We also should have sent you the shorter version of our bio, so you didn't have to read all that too. But thank you for having us. We're really excited to be here with Leadership Buffalo. As Althea stated, we are both graduates of the Rising Leaders class of Leadership Buffalo. Of course, I'm in the best class ever.
No, I think that's me.
Which is 2014. I know we go back and forth, but like I said before, Althea got a grandchild out of our class. And so we definitely are the best class ever. So Kendra and I are really excited to be here today talking with you all. And we're going to talk about a few topics that are really, they've been really coming up as of late because of what's been going on recently. When we are in our podcast, we always do a hot topic of the week. And so we're going to start there and then we're going to jump right in, dive right in. We dive right in to the topics at hand. So this week, we actually saw an article that the North Face, you know, we should know what North Faces are about because we're in Buffalo and have to bundle up. But the North Face company put $7 million towards diversifying the outdoors. And so on our first episode of our podcast, we talked about corporate social justice and what that means for organizations, especially after the death of George Floyd. A lot more people are trying to do things. They're trying to tie in racial equity initiatives. And there's organizations now that are looking to do things and actually put their money where their mouth is. So the North Face came out and put $7 million towards diversifying the outdoors because what they found is in a lot of areas where people of color are, communities of color, there aren't many opportunities to be outdoors.
Right. And they live in nature deprived places. And so they felt as if they give money, again, corporate social justice, give money to communities, as well as they partner with entertainment, that they will get more people out, people of color, to enjoy some of these activities. We also know that, you know, there was something in the article that said, you know, people of color are more likely to live in nature deprived places and faced with systemic racism when they do explore.
Yeah.
Which I think that was very interesting as well. I mean, we even see it earlier this year when it was the bird watching, right? You know, doing something like bird watching. Yeah. So I think North Face got it right on this one.
I think so too. And I mean, it really gives an opportunity for people to explore and do things differently. You know, in inner city communities where a lot of communities of color, people of color live, there's lack of green space, right? There's not livable communities where people can walk and get exercise in that way. And so what people are trying to do now, what North Face is trying to do is to create that within those communities. And I think that actually leads into some of the conversation that we're going to talk about today.
When it comes to health disparities and social determinants of health.
Yes. Right. And so because my wonderful co-host talked about social determinants, let's dive right into that.
Right in. Yeah.
So social determinants of health, those are all the factors that create opportunities for us to be healthy. So where we live, where we work, all those different factors actually make up our overall health. And so they say about 15% of our overall health is related to having access to doctors. So if you can, you know, get your checkup, you have a primary care physician, but the 85% is really related to things like economics. You know, what type of job opportunities do you have? You know, what type of neighborhood do you live in? Is it safe? Is there access to fresh foods, fruits and vegetables. And we know that there's a lot of communities that aren't necessarily close. And so all these different factors really make up how long we live. And they say that based off of your zip code, we can actually tell your life expectancy.
Right.
And so if we live in a specific zip code, there's ranges for how long you're supposed to live if you've lived there your entire life, just based on having access to job opportunities, access to, obviously healthcare, but then other things like the neighborhood safety, and geographics in general. So,
So then earlier this year, when COVID-19 hit, it was very interesting because we constantly heard about zip codes within the city of Buffalo, mainly on the east side, that got hit with COVID more than other areas within Erie County. And so we talk about social determinants of health, and we talk about how people are living in these zip codes. And within Erie County, there were 5 zip codes that has 75% or more Black people living in these areas. And they, the COVID was rampant through the communities. And that's attributed to so many different things. We have, more families living together. So you have more people in a household. You have, also too, we talk about green space with North Face. You don't have the ability to necessarily get out and walk and get to certain areas because you're so condensed and close together. We talk about, there's a lot of people in the city of Buffalo within these specific zip codes who are healthcare workers. And so they're frontline workers. And so they go into the hospitals every day and assistant living and certain things like that. And they're maybe bringing something home, or they may be taking public transportation. So now you're in these clusters. And so you have all of these things that attributed to some of the high cases that you were seeing in with COVID-19 earlier this year. I just wanted to bring some statistics in here. So according to the Buffalo News, on May 7th, within Erie County, per capita cases were 88% higher in the county's 5 majority Black zip codes than they were in the rest of the county. And that's very telling. Also, too, Black patients also accounted for nearly 19% of Erie County's COVID-19 deaths, although people of color make up 15% of Erie County's population.
Okay.
So those are just telling statistics there of just telling a story of how, this attributed to COVID-19 and the increase in cases and deaths.
And honestly, nationally, this is the trend, right? We've seen this nationally where there's a lot of communities of color that are disproportionately impacted by COVID-19, and we're still in the midst of a pandemic as well. So one of the interesting stats that I actually saw coming out of COVID-19 was related to our deaths and how Erie County did compared to other folks. And so they said that in terms of the deaths, we actually didn't outpace other areas based on communities of color dying from COVID. And I don't know if that's, I know there's a lot of organizations that did testing, in the beginning, testing was really limited, but over time, and very quickly over time, we had testing sites all over popping up in communities, and especially in communities of color where, we were getting it more than other people. So I think, although statistically looking at the country and where people were getting it were more people of color, at least here in terms of the deaths, it didn't outpace. We were under trend compared to other people.
Right. And like you said, there are so many things attributing to that. Also to UB, with Community Health Equity Research Institute, they did a really great job as well in getting the word out about COVID, but then also to supplying our communities with resources to help combat some of these things. So I know within my neighborhood, within my zip code, there was a lot of communities and groups getting together, delivering groceries. I mean, we saw that throughout the beginning of the pandemic, but delivering groceries to those who not necessarily can't even just get out, but, who otherwise probably take public transportation to get to grocery stores and things like that. They also did, which I thought was really interesting, they did phone banking. Just so it was, let people know the severity of what has been going on.
Right.
And so we see these groups get together and really help push, to make sure that we're safe.
Yeah. And honestly, all of this connects to racial equity. And that's a conversation that we've been having a lot on the podcast. In order to achieve health equity, we have to make sure that we're paying attention to racial equity. And so those two things connect hand in hand. Policy Link actually came out with a study on what we need to do as larger communities to make sure that we're addressing racial equity because it connects to health equity. And so when you look at all the outcomes, of all disease categories, normally people of color are at the highest level in all those specific categories. And so what other areas, systemic areas are happening, that make us be at the height of all these different categories? And I think that goes back to some of the social determinants of health. So access to care, that's one component. How many people are using primary cares? We know in communities of color, we're seeing a lot of people utilize, emergency rooms instead of having access to doctors and making sure that you have the preventative care that goes alongside that as well. And so we want to make sure that we're looking at racial equity as an impetus to getting to health equity in general.
Right. And I heard earlier this year too, that really, racial inequality should be another pandemic. It should be put up there with COVID-19 because it is a high priority issue that we are seeing. And I think that, if COVID-19 did not happen, I don't think that we would have saw all of the implications behind it. And there are so many things that are happening within our West New York community. We look at a lot of health insurance companies. They are doing so many things within our communities to help combat some of these things, high blood pressure, heart disease. And so I know, our local insurances here, Blue Cross and Blue Shield, Independent Health, they do a lot of summer activities in the parks, Martin Luther King Park, Canal Side, and then other places around the city. And that's not just to say we're doing something in our community, is making sure that you're putting programs in place to help decrease some of the issues that we're seeing.
And what's interesting as we talk about health disparities, there have been a couple of governors who have come out and said racism is actually a healthcare issue because we see that the impacts of systemic racism having on our healthcare system. In healthcare systems, they're starting to look at data to look at who has the highest number of things and how can we impact health outcomes to make sure that that's not happening. One of the things I think that they're doing is making sure that the people who work in the systems are culturally humble, which means, when somebody's coming in with an issue, all the biases that I have as a person who might not connect to somebody who's coming in are checked. And, you're giving that person more time, or you're giving that person more of an opportunity to explain the different issues that are happening. I mean, health literacy is a big one as well. When you come into a doctor's office, it could be intimidating. You can come in and you might not have the language that you might need to even have the conversation. So when people, providers, which are doctors and nurses, and folks are coming to talk to you, making sure that the forms that you're filling out are forms that are written at a certain level so that everybody can understand them. And so we're starting to see more organizations do those things. But we know that health literacy is one of the things that we need to focus on as a whole.
Right. And, you say culturally humble, but I also say culturally competent as well. That kind of goes hand in hand within the healthcare system. And, when we talk about healthcare, there's a lot of conversations that we have when people say, I really want to see a Black doctor, or I want to see a certain doctor, or, mental health is huge, which is another part of health. And a lot of people say, well, I want to see a mental or Black mental health doctor. All those things play into understanding the patient, understanding, some of the things that they're combating, health wise, and understanding what really plagues our community. So, obviously we want to see more physicians of color, but to your point, being culturally humble, being culturally competent is another part of what I think are now starting to see. And I did read that UB is really teaching that too.
They are. Yeah. And so that institute that you mentioned, it's the Buffalo Center for Health Equity. There's a partnership of a lot of organizations, like healthcare organizations here in Buffalo. But that's exactly what they're doing. They're connecting to the med school, the UB Med School, and they have different courses now that teach people that, and so I say culturally humble, like they talk about cultural humility, because that we know that there's never a point in time where we're going to be culturally competent in someone else's culture other than our own.
Right.
So we can learn things about other people. We can empathize. We can, make sure that we're understanding where they're coming from. But at the end of the day, unless you live in that person's shoes, it's really tough to say, I know where they're coming from completely. So we have to make sure that we're aware of how we show up in these spaces and places so that we can, put that stuff aside in order to listen. And I think, as you start, there's a bunch of resources out there to start learning more about this. One of the books that I'm actually currently reading is Medical Apartheid. Mm-hmm. And they talk about a lot of the issues, like how did we get here? How was our healthcare system built? And it started in the time where, it goes back to slavery, and it goes back to when slaves were purchased to have different treatments tried on them. Mm-hmm. And so one of the things that actually came up was, and I want to say it was Thomas Jefferson, and there was the connection there where there was, the lung spirometer. So basically there's the machine that you use to try to see the functioning of your lungs. And although he wasn't a medical doctor, he was more of a PhD in that sense. They talked about how they would change the gauge on it because they said that the slaves didn't have the same lung capacity, and therefore slavery was better for them to, build that function within their lungs. So there's a lot of stuff like that. And in the 1619 Project, which is something that came out recently, they talk about healthcare and the connection to slavery and how we came here. And one of the things that they brought up was this, and they said that in certain areas, that still is the case. So they changed the gauge to say, as a Black person, your lung functioning is different because, because of that,
right,
and where it came from.
It's interesting that you bring that up, though, trust in healthcare, because a lot of people of color do not trust the healthcare system.
True.
And that is a issue within itself. Obviously, we look at even going back historically, the story of Henrietta Lacks. I mean, using her cells for research, you have
all over the world,
right? And not getting, she didn't even know. We have even Fannie Lou Hamer, who was a civil rights activist who went in for simple surgery, came out with a hysterectomy.
Right.
I mean, these are different things that has happened to our people, and which is attributed to the lack of trust within the healthcare system.
I mean, Tuskegee experiment, and that was 1960s, where they were testing syphilis on men of color, Black men. And so because of this really tumultuous history, this evil history in terms of how we got here as a country, it really has made it difficult, like you said. So we need to make sure that we're putting that into the care and having that in mind. You have to design programs so that people of color feel more comfortable and trusting. I mean, related to COVID-19, there's been a lot of talks about this vaccine that's coming out.
Yes.
And I can't tell you, I mean, I talked to some of my family members, and they're like, look, I don't know if I'm gonna get the first round or the first batch of this vaccine, especially because it's been so heavily politicized. And what I learned actually from some of the folks that I work with is that because the government actually took away some of the restrictions to testing it, they've been able to test multiple vaccines on a lot more people,
right,
which would essentially make it safer to take. But because it's been so heavily politicized, people are saying, I don't know.
Right.
I don't know.
I know. We have those conversations all the time.
Right.
And I always think about, like, where do we go from here? Like, where do we go? Like you said, there's programming, there's a lot of collaborations. And, always look in Western New York first. There's a lot of collaborations happening within Western New York. For me, where do I start? I start with our kids. I start with the children. And within even my own neighborhood, what is almost sad is that we don't have viable grocery stores. And we talk about these food deserts all the time, and we talk about programs and giveaways and things like that, but let's really get at the root issue here. Let's get at the fact that there's not really many viable grocery stores within our communities. A lot of our people have to go to the suburbs through a bus, whatever the case may be. We have Dollar Generals, we have Family Dollars, we have corner stores, but we don't have grocery stores. And so that's something that I've recently been looking at to advocate for, not just downtown, but in other areas as well, that's accessible to everyone. And so for me, that's my little project, is to really make sure that we have grocery stores in our area. And that will lead to everything. Make sure that kids are alert when they're well, not at school, but when they're learning online, making sure that they're healthy, making sure we don't have some of these issues that we see plaguing our communities now, high blood pressure, heart disease, all these things. I think if we start now young, obviously, we want to do other things too, but if we start young, these issues will kind of dissipate.
Yeah, and it's interesting that you bring up some of the corner stores, because I know the city of Buffalo, in partnership with others, we're trying to do a healthy corner store initiative where they gave refrigeration units to corner stores so that they could have fresh fruits and vegetables and perishable items so that people in that area could access it. I know when we look at food deserts, we look at the costs associated with someone who doesn't have access to transportation, who might not be on a bus line, what it is for them to get from their homes to a grocery store. And then think about that. You got to bring all that stuff back, depending on where you live, it's a hassle in itself. And I know there were some stats that talked about the average cost was around like $26 to $30. And if you are coming from, lack of income or are hard on income, that's a lot of money for one trip. That's like a round trip to the grocery store and back. Right. And so these are the things when we talk about the social determinants of health, transportation, access to, affordable housing, all these things make up someone's general health. If you have diabetes and have to refrigerate your medicine, right, but you might be homeless, what do you do in that sense? And what do you do, so I think we got to start to think about all these different connection points and how we can fortify them to make sure that we're strengthening our entire community.
Right. So I like to pause here. Yeah. And we've said a lot. Are there any questions in the chat? We can't really see, but are there any questions?
There is, there's a couple questions that I think we have. I'm with you, first of all, because Kendra, whatever you need as far as the grocery initiatives, because it's a passion of mine. It's wrong that people that do not have the ability to be able to access food. Even living where we live, Ekua, we don't live too far from each other. It's a ways to a grocery store. Yeah. We happen to have cars, so it's acceptable for us, but we study that at Leadership Buffalo. So whatever we can do to help. One of the questions that was asked actually in the chat room, but it's sent to me privately. What are the thoughts that you ladies have on the relationship between education and health disparities?
Oh, yeah.
There you go.
I'm like, we're looking at each other like, to jump in. I mean, education is a social determinant of health as well. And so, if you don't have, I guess, if you aren't as educated, we talk about health literacy. It's a lot tougher to understand what might be going on with your health or even know the proper things that you should be doing within your own health.
Right. And I think about, again, I go back to school age children because that's where my mind goes up now being in the school. I guess that's where my mind goes. But even, going back to school age children, we look at the fact that there are pockets in the city of Buffalo that does not have even 4G network. We're talking about 5G happening, but there's places in the city of Buffalo that does not have 4G. I ride through them all the time and, I don't even have, service or whatever. And I just can't imagine if people who are living in these areas that don't have service and access to information that we have at our fingertips. I mean, if we want to look up, something quickly in terms of a statistic or, what doctor to go to, we can't do so if we don't have access to internet, just simple things. And now we have a lot of these students who are remote learning who cannot even get in sometimes because the internet is just super slow. So just imagine, you can't have the information that you need. There's a lot of times where doctors or whoever may say, fill out this form online or do this online. But if you don't have access to that, you can't do so. And so it's all linked to, social determinants of health.
And I think that's a good point you bring up in terms of the technology piece, because I mean, as we were thrown into COVID, us that work in healthcare had to find innovative ways to reach our patients during that time. One of the things that came up was telehealth and having access to telemedicine. Now, there were a bunch of regulations or requirements before that didn't allow us in the healthcare field to even access telehealth to do that. But when telehealth did come on board, who had phones? Who had internet, to your point? So if you were trying to see your doctor through the phone, which of all, we'd rather not do that because having someone in your presence is a lot better of an indication to tell what ailments might be going on. But if you have a phone or you don't have a phone, now that's a barrier. That's another barrier that would restrict you not being able to see a doctor during this time. And the more and more people that I talk to, even in the cancer area, people's conditions have worsened because they didn't have access to their doctors during that time. Right. And so people also were nervous and scared to go back into the hospitals and back into care. And now that they're showing up later when everything is, opening a lot more, their conditions are a lot worse. So we're seeing disparities. We don't even know how this is going to impact us. And honestly, doctors are saying that it's going to impact us for decades to come. We don't really know. But based on those disparities that existed before COVID even happened, we're already behind. And so those are things that we're going to have to focus on as we move beyond this. But, they're definitely coming up.
Right.
Thank you. All those things, I think about the lack of internet access, as you just talked about too, especially when kids are trying to learn at home right now. And say there's 3 or 4 kids and mom and dad are trying to work too. I mean, it's, it's not right. You can hand out all the devices that you want, but you need to have all the tools and able to be successful. So this is another question from the audience. So how can we get healthcare institutions to invest in environmental factors and SDOH as a form of healthcare? I don't know what SDOH stands for.
Social determinants.
Oh, okay. Thank you. Our healthcare system is set up to treat sick people. Are there examples in Buffalo or doctors or organizations who are treating social determinants of health as a part of patients' holistic health status instead of just the diabetes or heart disease?
Yeah, and I think that's what we're seeing in a lot of the healthcare insurances. There's a lot of partnerships that are out there where we have people who are part of the companies who will sit on the boards of different initiatives. And I think, when we look at some of the initiatives that are playing out in our communities, they are trying to address the holistic point of view. They're not just, getting to a person when they get to the doctor and say, okay, we're going to diagnose that person. They're starting them at school age, and then they're bringing them all the way up because I used to work at a healthcare insurance company, and those are some of the things that we had talked about all the time to say, how can we avoid someone coming into the doctor's office at age 60 saying, oh, I have chest pains and I have high blood pressure. We look at, again, environmental factors, like the one in the question, we look at so many different things. And back to even what we were saying earlier, if someone can not necessarily get on the bus all the time, and if they had their own vehicles and that's a whole nother conversation within itself, because you now have to have that education to have the job to provide. So that's a whole nother comment. But if we, there's companies out there that definitely look at the patient, and I say not patient, but member holistically before they get into the doctor's office.
So I'll just add on that. I work at Evergreen Health, and we look at it from a comprehensive, in a comprehensive way. So we have programs that have transportation as a factor. We have housing initiatives for people that actually need housing, affordable housing to live in. We have wellness and nutrition. So we're looking at all the different components, teaching people how to eat depending on what ailment they might have. And these people are touching different parts of our organization before they even see a doctor, right? And they might be coming to us for other services outside of primary care. But that's exactly what organizations are trying to do. We're trying to put in place a system so that you can come, it's a one-stop shop. You come in for one thing, and we can allow you to hit all these other things at the same time.
Right. And I would say that's something that's newer. When I started in healthcare about 10 years ago, we never thought about those things. I wouldn't say never, but they were in the background. We were, worried about the patient once they got to the doctor's office. And also too, for companies like Evergreen or even insurance companies, you keep the costs low once you are able to intervene earlier on.
Right.
You don't want to wait till they get to the doctor's office and they have a high utilization rate of prescription drugs and visits and things like that. It keeps the cost low for the member, number one, but then also to the insurance companies.
Yeah.
Yeah, that's great stuff, ladies. Great stuff. So this is kind of a two-part question. Have you known anyone personally that has experienced this disparity in healthcare personally, but also at the same time, how do we resolve the lack of trust in the healthcare system among the Black community while being respectful to someone's past health-based trauma? Did I confuse you?
Ooh, I only heard part of the question.
You want me to read it again?
That was a loaded question. Yeah, can you read it again?
Sure. How do we resolve the lack of trust in the healthcare system among the Black community while being respectful of someone's past healthcare based trauma?
Whew, that's a heavy question.
Yes.
You know, in terms of the trust factor, I think you have to be consistent, right? Like you have to be consistently showing up and consistently coming to the table with someone. One of the things I think about, like language barriers, right? And we have a huge population in Buffalo that's growing, that are new Americans that are coming that might not speak the same language that we speak. And so you see people using translators, you see people having, you know, bilingual receptionists and bilingual people that are coming in to be able to translate. And that in itself will help people kind of feel a little bit more at ease and reduce some of that anxiety. In terms of the other trust components, I think it is just, you know, you might also have to partner with other organizations. So we see a lot of collaboration that's happening in the community with faith-based organizations, you know, churches that are coming to the table and having these discussions with their congregations saying, hey, when's the last time y'all went to the doctor during a service or an announcement? And then having partnerships as well with, you know, with healthcare providers and saying like, let's come to the table together. So when you mentioned the Buffalo Center for Health Equity, there's a lot of faith-based organizations that are at the table who are the conduits between the people and between the providers as well. So I think it's a loaded question and it's tough to answer in that way, but those are some of the things that I've seen in healthcare happening. I don't know.
Right. Well, even, you know, the UB Community Research Institute that's now existing, they have pastors on that with that group, and that advisory, because that forms that trust. Even when you look historically at churches and pastors, the church has really been that community-based organization that has people of trust and keep groups together. And so I think, you know, we can definitely start there. Again, partnerships. I see a lot of organizations partnering with, you know, NAACP or Buffalo Urban League, things like that, because you have to form that trust within your community. And then the last thing I would say is, you know, if you are thinking about setting up shop somewhere, set up shop in these communities that, you know, traditionally have been left behind.
And include them.
Include them. You know, we see doctors doing that today, where they are part of the community and they have that trust. And that happens right here in the city of Buffalo.
Right.
And so I think you have to partner and use organizations in order to form that bond.
That makes a lot of sense. And you mentioned the cultural issues too. And there's so many different cultural norms from our new Americans that they aren't comfortable going to be going to the wife going to a male doctor. And there's a lot of things like that they're uncomfortable with, and we have to accept that and really understand that as well. So I have a question. This is my question. So with the Supreme Court recent nominations, this is a good one, and pending election, what are your concerns over the Affordable Care Act and the potential implications of what may or may not happen?
That's heavy.
Yes,
it's heavy.
You can handle it.
I think, you know, definitely with the Affordable Care Act, it's been a huge controversy since its inception. And, you know, not to, you know, say one way or the other, but I think the Affordable Care Act provided access to so many different people who traditionally did not have access before. I know, you know, when it came out, I was not 26 yet. And so I was able to stay on my parents' health insurance until I was 26. And so it's done so much for so many different people. When it comes to now playing out in the political realm that we're seeing today, I think that it will have, you know, a huge implication on the Affordable Care Act. And I mean, women's rights.
Talking about it now.
Talking about a woman's rights, you know, all of that. And there's just so much to say about that.
Yeah, I mean, I guess like if it were to go away, and I guess that's the question. A lot of people are talking about pre-existing conditions right now, and that's a big thing that you know, we want to make sure that people that do have pre-existing conditions have access to care regardless of what happens. And so I think that's the biggest implication. Are people that have health conditions still going to, you know, be able to be taken care of in that realm? I think, you know, to your point, the women's issues are coming up as well. Access to safe abortions. Those are things that people are questioning if that's going to still be something that can continue to happen in our country based off of the implications of the Supreme Court.
Right. And the pre-existing conditions is the biggest piece too, like you just said. There was a time where you would get denied just for something small because, you had diabetes, whatever the case may be, you had a waiting period, all of these different things. And it attributes to access of care overall. If we can get access of care in our communities, a lot of the issues that we're seeing will definitely start to get better.
Yeah.
And so what we're seeing play out in the political realm is hard to watch. In my opinion, it's hard to watch because, the Affordable Care Act has done great things for so many people. And I think personally, if we were to do without, it would do more harm than good.
Yeah.
Thank you for that. I agree with you 100%. I think it's not a perfect system, but it's certainly better than what we had before. And I think it needs to be tweaked and continue to grow versus go away. So fingers crossed. Let's talk a little bit more. There's no questions in the chat room at the moment, but let's talk a little bit more about the health disparities and, whether it's COVID related or just in general. And, have you experienced anything personally or your family members or people that you know closely with this?
Yeah, that's a really great question. A couple different things come to mind. One is maternal health, and especially as it relates to Black women in maternal health, we have some of the highest mortality rates among Black mothers who are trying to give birth, as well as the children that are born too, like in terms of infant mortality as well. This was connected to one of my really good friends. I know that they had a high risk pregnancy. And honestly, a lot of times they say that if you are a Black woman, you're high risk just because you're Black. And your experience in giving birth makes you high risk. I had a friend who went through a lot of difficulties and ended up needing to be on bed rest. But it makes me think about like Serena Williams. And so they talk about economics, right? Economics being that deciding factor in America. If you have money and access to money, you should be good. But the reality is you're not. And so there's a couple different cases. Serena Williams comes to mind. She knew that she said, I have blood clots. Like I could, something's wrong. I need to be checked. They said, no, you're fine. You're good. And she demanded it. And it came up that she actually did have blood clots. And so even being heard and listened to is something that a lot more healthcare organizations need to think about as it relates to communities of color. But we know that mortality rates are high among us. But that's something that I think we have a lot of work to do in. So that is an example. I mean, I've had family members who also had COVID and ended up being hospitalized for that. But just the connection to the doctor, I talked about the health literacy component. I think a lot of people of color sometimes feel as though they're not listened to or heard in those situations. There was a comedian that came out, and I think this relates to some of the opioid conversations that are happening too. And that's an area where people of color they are getting hit hard in that area. But when you think about the prescription before some of these regulations came out, if you were a person of color and you went to the doctor and you were in pain, take some ibuprofen and go home.
Right.
That's kind of the nuance behind that. But they would overprescribe to, Caucasian people all the time as well.
Yeah, I think, with COVID-19, it's an eye opener for so many different, different people in healthcare systems to say that we have to do things differently. We see that now even there's health insurance companies providing PPE to different communities, understanding that they have to be more than an insurance company. And I think that is what we're seeing now play out. Personally, I've known people who've had COVID. I've had a family member who was really close to me, unfortunately passed away of COVID. And just, dealing with all of that and navigating the healthcare system, I think is really important. Learning how to navigate the healthcare system. It goes back to, there's a lot of times where people say, oh, use telehealth or, use your member portal or whatever. But again, if you don't have access to these things, it makes it very difficult. So I think right now we're reimagining what healthcare is going to look like. I think right now we have this hold up at the national level, but we're reimagining what healthcare looks like so that we won't be put into this position again, hopefully, and that we can address a lot of the determinants that we're seeing.
Thank you for sharing that. You talked about, the healthcare changing. You mentioned there's a lot of challenges. You mentioned COVID a couple of times as well, but a while ago, you mentioned many individuals relied on the emergency room for basic care in normal times. And then how do you think that's changed during COVID? Because maybe some of these people can't do telehealth. I know I did telehealth for the first time ever during COVID. What do you think has changed? I mean, are they getting the care? Are they not getting the care? Are there any statistics or facts on that?
I haven't really looked into that the statistics wise, but I know that, when COVID first started, there was a lot of commentary about don't go to the emergency room. You're better off staying at home, not, contracting anything if you don't have it. But also to making sure that your safety is put first. So there was a lot of commentary around that. And there was some some hospitals just said, what are from the front said, what are your symptoms? What are you experiencing? No, go home.
Yeah.
And so now I haven't been in, a hospital recently. I don't know what it looks like. But I know personally there has been some people who just said, well, I'm not going to the hospital, or I'm not, getting the care that I need because I'm afraid of contracting COVID. I know also too, one thing that's been really huge is I know people personally whose medications are all screwed up.
Yeah.
I mean, that is a huge thing right now is they're not on their normal cycle of medications, because a lot of times you need to go and get, authorization to get the refill. And so you have to either go into the doctor's office, the hospital, or telehealth. And so I know a lot of prescriptions are all messed up. I mean, it really threw a wrench into our total healthcare.
I think a lot of people are starting to re-envision like community health workers in a different way, as well as care coordinators who do have a connection point, and they communicate directly with that person and ensuring that they follow up for different appointments, or, is it time for your refill of your prescription? Have you done that yet? And so I think we're going to be utilizing a lot more community resources to make sure that people are getting the care that they need over time.
So, and in the emergency rooms and people not going and medications being screwed up and things like that, do you think that is more prevalent in the African-American community? Did you girls hear me?
Yeah. I think I don't know if we're breaking up or not, but I think it's more of a social economic status instead of necessarily can you hear me, Althea? Okay. So I think it's more so at the social economic status than necessarily the communities of color. I mean, ultimately, obviously we see communities of color playing out on the national platform, but we look at rural areas within West New York. We have Alden, Akron, Wales, you name it. We have a lot of rural areas within our West New York community, and I'm pretty sure it's playing a hand in that as well. Way back in the day, I used to work for a company or a non-for-profit where we would really use volunteers to provide transportation to people within rural areas to take them to doctor's offices, whatever the case may be, because they didn't necessarily have that transportation either. And so I can only assume that that's also playing a factor into what we're seeing now. So I wouldn't say necessarily just communities of color, but I would say it's based off your social economic status.
And they're also saying that in these areas, and that's why, COVID awareness is that important too, because they don't have the access to that many healthcare systems in these rural areas either. So if they get bombarded, they're really, going to be in a really stressful situation. I think the other thing is we're looking at federal funding across the nation right now. We're also looking at state funding being cut in certain areas, and those are impacting some of these community hospitals in these areas that rely on that funding. And so if you don't have access to getting PPE and things like that, that's where you see people in some trouble for sure.
Right.
So many things to think about. So before we close, I just want you guys to touch a little bit on something, the mental health. I know a lot of people that struggled with mental health and living, at or below the line are really suffering, with the COVID and the restrictions and everything. Do you think the African-American population has been affected more? Do you think they're able to get the care that they need? Anything that you want to chat about in that area?
Oh, we could do a whole podcast on this.
Well, give us a little tip and then maybe we'll do another one on that.
So we talk about mental health in the Black community all the time. Previously, I think this year and a little bit before, mental health, going to a mental health professional was almost like a bad stigma attached to you. It's like, oh, you're going to go see and talk to someone, you must be crazy. You know, and I think that was what a lot of people actually thought about when they thought about going to a mental health provider. Now, I think I know it's essential to go to a mental health provider just to talk about everything that's going on. I once heard someone say, you know, being a person of color in America, you have mental health issues, no matter if you want to admit it or not, but you have mental health issues. Even with COVID, we're living in two pandemics. We have COVID-19 and we have the racial unrest that we're seeing and unrest that we're seeing. And it is not normal for anyone to watch someone dying on national TV and he's seeing it repetitively. It's not normal. And so that sits with you. You know, it's hard to sometimes go about your day when you're seeing things like this, these messages, knowing that COVID-19 is plaguing your communities. It's very hard. So mental health, I always say mental health is wealth, but it really is, because what we're seeing in 2020 is not normal for anyone. And so when you're looking at mental health and looking for mental health providers, if you're out there, please make yourself known, because I think a lot of people are seeking for mental health professionals at this point.
I was just going to say that and this is even talking about privilege to a certain extent, because if you do have health insurance, or if you have access to resources, because telehealth became a real thing and people had access to it, it did allow you to, as long as people were in New York State, find a mental health counselor in New York State anywhere. And so in our area, we talked about finding Black doctors or finding mental health professionals who look like you or could relate to you. And you could go to downstate, right? You can go to New York City and see somebody utilizing telehealth services versus having just to rely on your current community. But to your point, I think, mental health is vital at this point, and everyone is struggling. Everyone is struggling, Black, white, whatever, at the end of the day, because we're all living in a global pandemic right now. And so if you haven't talked to someone and you are struggling, I do highly suggest that you look somebody up and try to get access. If there's any other resources that you can think of, we might be able to plug that in our show notes for folks to kind of look at.
Organizations, crisis services, they have their hotline, the Horizon Health, Best Self. I mean, there's so many wonderful organizations that if they specifically can't help individuals, they can certainly be a resource, especially crisis services. So we have somebody who has a question. I'm just going to put it in here. We got one more question coming in, I think. So there's one thing that I always like to say is that healthcare should not be a privilege. It should be a right. And
absolutely.
For everybody, we need to get to that point. So I think there's a question coming in. So I don't know. Anything else you'd like to close with, ladies, or add to our conversation?
I don't know. This has been a really great conversation. This is, obviously we talk about healthcare, and it's so many things that you can talk about with healthcare, but I think now is the time to really reimagine what healthcare looks like. Like you said, Althea, it is a right. And so everyone should have a right to healthcare. Ekua talked about, making sure that we have community resources available for everyone. And so this is really a time to reimagine what healthcare looks like and make sure that it is delivered effectively to everyone.
I think that's our gem of the day.
Oh, yeah, gem of the day.
We always end with a gem of the day. And so, to your point, healthcare is a right. And we encourage people to really take that responsibility on and connect to people to have a higher level of care.
Thank you so much. You two are amazing. I just love talking with you. And we were just saying we could have you do this every week for us. We can
come on the show.
Right.
We have another mic set up.
You have great chemistry with you as well. But I want to thank you and really thank you. Both of you do such great work to supporting the Black community and really being a voice for your people. And also, I think both of you work in the diversity, inclusion, and equity space. So if anybody needs anything, I think these two are a gem. I got that in there. I didn't even do that on purpose. But I want to thank you so much for your knowledge and your your support of Leadership Buffalo and also the knowledge that you imparted to our audience today. So we were on Facebook Live as well as in our town hall here. So hopefully we'll be able to share this great information with many, many people. So you both stay well, and I hope to see you both in person soon.
Thank you. Thank you for having us.
Have a great night, everyone.
Bye, everyone.
Bye.